Welcome to the Cardinal Minute with your host and chair of the University of Louisville Department of Medicine, Dr. Kim Williams.
And good morning, and welcome to a Cardinal Minute. I'm Dr. Kim Allen Williams, chair of medicine here at the University of Louisville, and it was my pleasure, as a pleasure for all of us, for our Gaspar Care Scare annual lecture in nephrology to host Dr. Laura Mariani. She's an associate professor of medicine and associate director of the Nephrology Fellowship Program and assistant director of the medicine clerkship at the University of Michigan Medical School. She gave a marvelous talk entitled Machine Learning and Digital Pathology for the Clinician. Dr. Mariani, can you please give us a 1-minute summary of your talk?
Absolutely. And thanks again for having me. It was a really wonderful event. So what I tried to cover today was that, machine learning approaches are being applied widely in medicine, and I think have real promise to answer some of the most challenging clinical questions we have about uncertainty in diagnosis, heterogeneity in progression, and response to therapy. And I think this is really especially relevant in rare kidney diseases, where we have to maximize what we can learn from each individual patient. But obviously, there are some real pitfalls that you can use in machine learning. And so we talked through some of the approaches and pitfalls. I think one of the most promising applications that we talked through today was to application of machine learning for digital biopsy images. And so we talked about identification and quantification of features from those biopsies, things we use currently, but also novel features. And then to be able to take longitudinal data from our patients and really better understand which of those features can help us identify, prognosis and response to therapy. So the field is moving so quickly, and I really hope that actually in all of our careers, we'll get to see these technologies move into the clinic and be able to improve care of patients.
Fantastic. Really was highly instructive, and have to take advantage of the fact that we have one of our most prominent nephrologists, Dr. Dawn Castor, on the broadcast with us. If you had any comments, Dr. Castor?
Yeah, absolutely. So in the rare kidney disease world, where we're primarily dealing with a variety of glomerular diseases, one of the challenges is that not all patients respond to therapy, and the therapies we use can be very toxic. So identifying which therapies may work for an individual patient is really, I think, key to the future of medicine in this field. And the other comment I have is, with new therapies becoming available, Dr. Mariani mentioned IgA nephropathy, and this is a field where we've had 3 new FDA-approved therapies in the last 2 years. Identifying which therapy is ideal for each individual patient is also important. We're not there yet, but I think the work that Dr. Mariani is doing will hopefully lead us to a future that has more personalized precision approach to medicine and therapy in nephrology.
Well, fantastic. Thank you very much. Thank you both. And we have learned so much, and I'm sure our audience will really appreciate it. And this has been a Cardinal Minute.